Hi, I'm Snyder, and I'm going to help you learn a little bit more about victim assessment. To start things off, you want to conduct a scene size up. So you want to take your standard precautions by putting on gloves and protective things such as that. And then next you want to assess the safety hazards in the area and determine the number of victims that were in this accident or incident that has occurred. And you want to determine if the victim is injured or ill or what might be going on with them. And you want to determine also if you need any more assistance, like the EMS or fire department or even the police department. And then next you want to conduct your primary survey. You manually stabilize the victim's spine if you believe that there could be any spinal injuries. And you also want to ask for the chief complaint. And you want to assess the airway, and if it seems to be blocked, you want to be able to open it if it is necessary, like to clear the airway. And if they need help breathing, you can perform rescue breaths on them. And you also want to assess their circulation of their blood by checking their pulse and assess for any major cuts that are bleeding so that you can apply pressure and stop the bleeding as well. And then you want to assess their mental status to make sure they're okay, do they understand what's going on, and help them in that way as well. And then you want to take a brief neurological exam, and you want to reassess their mental status of them and assess their alertness if they're talking. And you want to note their speech on how they respond to you, like if it's slow, if it's slurred, those sort of things. And you want to note the availability of the victim to obey things you're asking them to do. Like if you were doing an exam on them and you ask them to squeeze your hands and they're not listening, then that would be a sign that there might be something neurologically wrong with them in there. And then next you want to determine the chief complaint and obtain their vital signs. And by doing this, you want to ask the victim, where are you hurt? Are you ill? What can I do to help you? And then you want to assess their vital signs by checking their pulse, their respiration, their color of their skin, the temperature of their skin. And then you want to look to see if they have any medical dog tags. If they're diabetic, they might have a necklace on that says so. And then next you want to gather history. There is an acronym we use for this. It's called SAMPLE. Each letter has a meaning, so you don't miss a step. The first one for S would be signs and symptoms of the victim. And then the A would be for allergies that they have. M would be medications they're on or that they've taken. P would be their pertinent medical history, like if they've had any surgeries in the past couple of years or if they've had any heart attacks or strokes recently. And L would be the last time that the victim has eaten or drank anything. And E would be the events prior to the incident, like what happened before they fell and hurt their knee or something like that. And then next you want to conduct a secondary exam. It's checking the body physically. So you want to start with the face, mouth, nose, and ears. And then you want to check the eyes to make sure that they're following. And then you also want to check their skull and their neck. And working your way down to the chest, to the abdomen, to the pelvic area, to the lower back, and then to the lower extremities and the upper extremities. And that's all you need to know for now on the victim assessment.